Thank you, Chibuzo, for your candid introduction. And thanks everyone online for joining us in this section. So I'm going to lead the presentation, pretty much just setting the context for Serge to come in and talk about the WAHO information product, which is the main focus of this presentation. What I'm going to do very quickly and briefly is just to showcase the RAD initiative, just a few highlights on the RAD initiative itself, and then also the technical work that we do at the back end to make some of these information products that Serge is going to talk about possible. So without further ado, I will jump right in and then go through these slides very quickly to showcase what I was talking about. I'll try again here. You see now? Okay.
Okay, it's okay now.
Yeah. Okay. Let me see. You can see my presentation mode.
Yes, we.
Okay. So like I said, just a bit of a highlight on the RAD, which is a regional action through data. So essentially what I'm going to talk about also a few highlights on what the project is doing, and also some of the practices and technical practices that goes into some of the health information products that Serge is going to talk about. So this is the outline, a brief outline. I'll blow through it very quickly so that Serge can focus on the information products. So the first item we'll talk about, like I said, I'll give a quick orientation of RAD. The second part, few project highlights, and I'll also talk about technical best practices that goes into the work that we do. RAD is backed by a lot of experts from the consortium members. So a lot of work is done at the back end to make these products successful. I'll also talk about a few other items that I'll talk about. Data sharing aspect of the work that we do. Modern data architectures that we employ, and also generally the use of best analytics, new and best analytic practices that are currently out there that we apply in our endeavors. So RAD is essentially an initiative that was developed to enhance the current model of healthcare across sub-Saharan Africa by changing how and why information is collected, analyzed, and shared. It's a project funded by USAID with 5 other consortium members. As we can see, it covers 2 regions. Mostly West Africa and East Africa, with a population of about 620 million people. The consortium partners involved in the RAD project or initiative, USAID, who's the donor, Broadreach, the prime partner, also responsible for the data architecture. WAHO, which is West Africa Health Organization, an implementing partner for the regional and patient level activities. So we're gonna today, Serge will talk about the WAHO aspect of the work, some of the work, i.e. the health information products. We also work with IGAD, intergovernmental agency for development in the East African side. There was a session this morning about IGAD, so you can look it up and get some more information about that. Duke University, Duke leads our data sharing policy aspect, and then GEMB Systems, which is an actually technical and implementing partner for some of our technical solutions that we have on the ground running currently. RAD, during the co-creation process, identified two project areas. One, the regional level sub-purpose to equip stakeholders to make database decisions. So as you can see, for the regional level, we work a lot more. We work a lot more with WAHO. So today's the subsequent presentation by Serge would be one of the first aspect of this first sub-purpose. We also have a solution with IGAD. It's a patient level solution that allow mothers to receive health care vaccination services across the border, Kenya-Uganda border. I'll talk very quickly about the Jenny solution, which is the one I just mentioned on the IGAD side, where mothers are allowed to allow mothers to receive care across the Kenya-Ugandan border. It's a very innovative solution that, like I said, enable vaccination services for mobile population. It's the components. It includes an app that utilizes the near field communication technology. It's the same technology used in credit cards. So these cards are given to the mothers, issued to the mothers, and it allows the mothers to store vaccination data for their children. With this card, they are able to get services across the border. It's a very comprehensive solution with a lot of technical applications. So I will entreat. There's a complete video online that I will entreat the audience to check it out if they want a lot more information on that. I'll move on to one key aspect also of the RAD initiative, data sharing. As you all know, we're dealing with health, most of the time, health records and health information. And every comprehensive solution normally should be thinking about data sharing and protection in this industry. This is led by Duke University, but one major achievement with that is we've been able to successfully introduce a policy to the West African region for the first time. The policy was developed and validated internally at WAHO. It was presented to the Assembly of Health Ministers, and they adopted the policy. So as we speak, it's officially recognized by all member countries. There are a few steps that we're still pursuing, working with the member states and on some bilateral agreements to automate data push from the member countries to the WAHO data warehouse. Another area we do at the back end, it's data architecture, and we make sure that we encourage our partners to embrace modern data architecture. Some of the architecture that we are currently encouraging or employing at WAHO and IGAD, it's as you can see, this specifically to WAHO, collecting data from internally from WAHO, the DHIS. We also encourage data collection from WHO, the Global Health Observatory, Gavi, Global Funds, and social media, and a lot of other sources. We encourage the development of healthy data pipelines, storage and processing. We are embracing a new architecture. Those familiar will know what the data lake is, and also what that allows us to do is, as you can see at the analytical representation layer, it enabled the use of various tools to develop some of these health products that we are currently putting out. Also, as you can see, this is the current architecture we have for WAHO, the Regional Health Observatory, which Serge will probably talk a bit about. But as you can see here also, the data lake architecture that we mentioned that we saw kind of also fits into this architecture. In terms of data use and analytic practices, we encourage and improve communication and translation systems, and we don't hold back. We engage communication experts and consultants for specific products and content. We also engage experts for translation to English, French, and Portuguese. We engage experts and consultants for specific product design, and with graphic design and user interface for the products. Another area we look at is some data visualization. It's very important aspect of our analytics and data use. So we spend a lot of time embracing the new practice. As you can see, some of these we are aware of some of these precognitive cues that we need to be conscious of when putting out these products. A good one is the fact that our subconscious. We know that our audiences, their subconscious, will tell them what may be interesting, where to direct their attention to. Also, some practices with data visualization that we practice, that we use. It's decluttering your analytics and reporting charts, minimizing redundancy, providing strong headlines, very key points that makes reporting and this product very efficient for consumption. This last slide is actually actual before and after shot of a WAHO weekly epidemic bulletin. As you can see, before it had a lot of tables and formatting was not that optimal. So the after effect, as you can see, the after effect is it has a lot of well put together with the graphic, well graphic designed, and also now with charts, with actionable insights communicated in this. So this is just some of the back end stuff that we do as a group in the consortium to back our major stakeholders. That will be the end of my presentation. So please, any questions that you had for me, please, I will make note and then I will answer them at the Q&A. I think at this juncture, I will ask Serge to jump in and then talk about the core the core products that we wanted to share with our audience. Thank you all.
So we are going to talk about the health information products and the health information platform because we have an online platform to give on dates health information, and also the health information products we planned for the region. So first of all, let me introduce the region. So the ECOWAS region, ECOWAS is meant for economic community of West African states. So it's a community governing 15 countries. So it's something around 5,000 square kilometers and around 387 million population. So we have 15 countries, as I said, Benin, Burkina, Cabo Verde, Cote d'Ivoire, the Gambia, Ghana, Guinea, Guinea-Bissau, Liberia, Mali, Niger, Nigeria, Senegal, Sierra Leone, and Togo. So you can see it in the western part of Africa. So talking about the health information platform, what Frank was talking about when he was saying the regional health platform, our Regional Health Observatory, or RHO. Okay, good. My computer was freezing. I don't know where. Okay. So this of the DHIS2 technology, we started with the epidemic-prone diseases. So we try to build a network between all the different countries, and so the surveillance systems of the 15 countries, and they are sending the data. So we manage to have automatic, most of the time to have automatic data sharing, or even some other ways to get the data on the epidemic-prone diseases. And these are now stored in our platform, and they are shown in dashboard and so on. So we have information on the epidemic-prone diseases, have information on animal health, and we are adding service delivery data. And now the objective is to go to automatic data sharing with all the countries and with all kinds of data. So we are making bilateral discussion with countries for this. One of our good achievement is the COVID-19 dashboard. You can see the link. I encourage everyone to, yes, then I'll write it down on the chat later on, or maybe Frank can help me write it down on the chat. And on this dashboard, you have live information on COVID-19 outbreak in the region, and you can get specific information at district level for all the countries. So you have some screenshots about this. And after this, we had a platform where we try to make a lot of modeling and simulation on the disease, on the pandemic. So about how the disease will go, and also about scenario simulation. I can remember that we have a scenario simulation like for border opening to advise the countries whether or not to open the borders. We have scenario simulation for risk mapping. We did this in collaboration with Cooper Smith, and they were really, really helpful for this. And this also available, and it give information, guidance to the decision makers about where are the regions, which regions of the countries are more at risk of COVID-19 and so on. So all these are online applications which are available. Some are publicly available, but some are not. For the modeling, the simulation, unfortunately, these are not publicly available yet. So I shall quickly go to the products. So the delivery of the things we can show. The first one was about our contribution to the COVID-19 response. I already talked about this. So you can see all the daily the daily information we're giving. This is, for example, an estimation of the reproductive number. So we are giving daily information. All these are some screenshots of the different models we have. So we prepared for the region. We have the SIR model, for those who know. So this is an epidemic model which can help to make provision to forecast and even make long-term forecasts about how the epidemic is growing, how it's reducing, when we'll get the peak, and so on. And you can even try some scenarios like the introduction of some non-pharmaceutical measures or introduction of vaccine and so on. So this can be used. And now we are working on the multiple waves and also on the introduction of vaccine. Additionally to this, we have some products, so some reports we are making on health information. And this was our first objective, the first objective of the RAD project. The first report was to support the weekly epidemic bulletin. The weekly epidemic bulletin used to exist even before the RAD project, but the RAD project supported to have this epidemiological newsletter and to automate it. So now with the platform, the newsletter is automated, and every week you can even find it published on the WAHO website. Every week we have a summary of the different epidemics going on in the region. And you can see that since 2020, COVID-19 is not the only epidemic we have in the region. We have others in some places, in some countries in the region. And then after this weekly epidemic bulletin, we thought about another document, which will be biannual. And this biannual document, we called it Biannual Health Information Bulletin. So the Biannual Health Information Bulletin will give information every time on a new, on a specific subject, like what we have with the current one, which is going to be published shortly, will be a report on 1 year with COVID-19 in the region. COVID-19 was the first time COVID-19 was confirmed in the region was the 27th of February, 2020. And the latest country having a confirmed case of COVID-19 was Sierra Leone, which had its first confirmed case the 31st of March 2020. So we collected data from the beginning to the 21st of March 2021, and we try to make a report on this. So you have all the trends, you have all the estimations, you have everything. We're trying to put this together, and this will be like the health information bulletin for the first semester of the year. So every time we propose extensive analysis on one health question. And this is not done within the RAD unit or within the health information unit here in WAHO, but it can include several professionals according to the topic we are working on. So after that, we have another document which is the annual health situation. So the annual health situation, the methodology is to collect data, to ask the countries to collect the data. So we liaise with all the health information, the national health information systems of the different countries, and they collect the data. And the data is principally about the self-service delivery data. So here we are not using the survey data and so on, is the service delivery data, because we have noticed that this is very, very not well used enough, and you will see that there are a lot of quality issues, many issues on this data. And in our mind, we have these problems because the data is not used. Once people will start relying their decisions on this kind of data, they'll try to go and solve all these quality issues and so on. So the health situation gives a report on health service delivery, on health status, and also on interventions. So as I say, it's based mainly on routine data. And now, the latest document we are working on, it's a document we plan to produce every 5 years. So we had the 2015 version, which we are collecting data from 2010 to 2014. And now we are working on the 2020 version, where we collected data from 2015 to 2019. We have the draft document for 10 countries which are ready, and we are struggling to finalize with the other 5 countries. The methodology for this, maybe I'll take more time on this. We manage with the country HMIS services, so they collect the data and they analyze the data by themselves. We provide them all the support they need in terms of analytics, in terms of maybe visualization and so on, what they need. But the data, the report is written by the different countries. And then it's validated at country level. It's based on a validated list of trust indicators, because the indicators have been validated by all the representatives of the different countries. And the report, as I said, is validated at national level. So we are planning to publish this as booklets. So you will have the country profile of each of the 15 countries. And finally, we'll try to prepare a summary country profile, which will be like the health situation. So if I can make a recap, as health information products, we are planning to have something. We have something which publish weekly, biannually, so every semester. This is the health information bulletin. We have the health situation, which give the routine data annually. And now we have the health profile, which give a large vision of all the information on health for 5 years, with all the trend analysis and so on. And every time when you have a major health issue, like for COVID-19, we try to produce things, and all this information are used for both the regional level, so WAHO level, the ECOWAS level, and also these are used at the country level, because we use them and contribute to the country meetings, and they use the information. So I'm sorry if I've been quite fast, but the objective is to give time for questions. So thank you very much.